Okay, so you have the HHS Secretary Kennedy saying that they have the outbreak under control. Then the CDC says there are more than 11,000 cases, 41 states. Are the two contradicting each other?
Yeah, well, Lindsay, when we're looking at these rising numbers, we're actually looking into the past. There's actually a 6-week lag time between when someone starts to feel sick, they go to the doctor, they get tested, and the CDC actually finding out about that case. And many people may not even go to the doctor because they don't have symptoms, so they don't feel the need. So we don't even know that they're ill. So all that to say, this is really an undercount when we're looking at the numbers here. The cases could actually be a lot higher. Michigan alone is reporting hundreds of new cases on an almost daily basis. And this is a parasite that typically, transmits between May through August in the summer months. But this summer, we're really seeing record numbers here. So Kennedy was likely signaling the fact that they've identified at least one source, but health officials are continuing to look for any other potential sources that are leading to this rise in illnesses here.
And so what's the response from Mexico? Because we know that the Kennedy has also said that it was from Taylor Farms in Mexico that's the source.
Well, the Mexican health secretary essentially said that no lettuce has been tested positive, which is technically true. But U.S. officials here have done hundreds of interviews with people that were sick. They asked them, what did you eat in the days leading up to your illness? Up to 90%, Lindsay said lettuce was one of the foods that they ate. And when they tracked that lettuce back, it brought us back to this farm in Mexico. So that's the reason why they're pointing to Taylor Farms here as the likely source. And this parasite is notoriously difficult to test overall. It's possible that there's no contaminated lettuce at the farm anymore. It's all been distributed, but that's something that they're all working to make sure that that's no longer on the market there.
So what sources have officials linked to the outbreak?
So far, they're looking at shredded lettuce at Taco Bell locations in 5 different states. That's accounting about 1,600 cases, but there's still thousands of cases still out there, like I mentioned. Taylor Farms had a voluntary recall that went out to 27 different states. We're talking about fast food chains, food distributors, even grocery stores. All of them have now worked to remove those products from the shelves. But the FDA is tracking multiple different other potential sources here that might be leading to the rise in cases as well.
And so what should people do to try and stay safe?
Well, I would say if you have any recalled products at home, make sure you're throwing those out or at least returning them. When you're out at a restaurant, you might want to ask the server, hey, are you guys aware of this recall? That might be a good idea as well. And then when you're in the grocery store looking at the produce aisle, looking at lettuce options, you might want to avoid bagged lettuce, for example, and instead opt for bulkhead lettuce. That way you can actually peel out those outer layers, clean the inner layers. That can also reduce your risk here. And then, Lindsay, importantly, if you're starting to feel any symptoms, it's important to talk to your doctor about getting tested. They can also prescribe you an antibiotic, and that will help lower the severity and the length of your illness here too as well.